Hi everyone, welcome back to the Sanguinismo channel, where I talk about policy, academia, and how a fictional character, Yoisaki Kanade, helped me make sense of it all when nothing else could. Today, I want to talk about why the US mental health system doesn't just fail people, it's literally designed to. I've spent the last year working at a community mental health facility. I started on graveyard shifts doing mostly cleaning and security checks. And eventually I moved to daytime hours, interacting more with clients and staff. If you talk to anyone who's worked in mental health long enough, a few themes always come up. Burnout, hopelessness, and that the system breaks both the people it claims to serve and the people working inside it. Let's start with what it's like on the ground. Facilities are classified based on the severity of symptoms and the crisis level. Psychiatric hospitals handle clients in acute crisis, suicidal, homicidal, psychotic, or completely without housing or resources. Once stabilized, clients might be transferred to a lower level of care, like a crisis residential program, which is where I work. In theory, the system is designed to help clients step down gradually, developing coping skills as they go. In practice, it only works for clients with stable housing, income, or family support. Most of our clients don't have any of that. What we're doing isn't healing, it's triage, and we're failing constantly. Sometimes clients aren't ready to change, sometimes they're too deep in crisis to hear you, and sometimes they've been system involved for so long that they expect to be managed, not supported. And you still have to show up. You still have to act like it's working. This didn't happen overnight. The way we treat mental illness in America today is the result of centuries of fear, neglect, reform, and eventually profit. Historically, people with mental illness were hidden away, kept in attics, sent to workhouses, or passed off to others in exchange for money. Eventually, someone had the bright idea to keep them all in one place, thus the asylum. Conditions were brutal. People were chained, starved, and treated like animals. In the 18th century, the humanitarian reform movement introduced the concept of moral treatment. Patients were unchained, given freedom to walk, talk, and participate in daily life. These spaces weren't called madhouses anymore, they were called retreats, and they worked too well. As the demand for care rose, so did the cost. Enter insurance companies. They saw an opportunity where if they inflated prices, created the illusion of coverage, and raked in the profit, that $5 scalpel you paid for, it now costs $100 because insurance says so. When the retreats collapsed, care shifted to hospitals. Psychiatric wings became a business. Private psychiatric hospitals popped up with profit in mind and minimal oversight. That's where we are now. Privatized, underregulated, and treating mental illness like it's a product instead of a human experience. We don't treat people anymore, we manage them. We're taught to see any sliver of progress as a win. A client becomes slightly more self-aware. That's a success. Never mind they've been admitted for 4 times in the last year. Never mind they're still unhoused. That's not care. That's survivalism dressed in clinical language. Clients are admitted when they're too unstable to function and discharged when they're just stable enough to fail somewhere else. Meanwhile, workers are left overworked and underpaid, trying to pretend that this revolving door is recovery. In the worst moments, I find myself thinking, why can't they just try? Why aren't they doing more? Then I remember, the system doesn't give people the tools to succeed, it gives them just enough to survive and then blames them when they collapse again. I wish I could look every client in the eye and say, you're not broken, you're just tired and you deserve better. But I'm tired too, and compassion can't run on empty forever. Not every country treats mental illness like this. In Norway, prisons provide full access to mental health care, rehabilitative programs, and meaningful work. Incarcerated people continue schooling, they participate in community life, they're treated like people. In Iceland, Youth substance abuse was addressed not through punishment, but through community programs, intervention, and data-backed policy. These countries didn't wait for people to collapse. They built systems that helped people stand up. Change won't happen overnight, but it can happen. And it starts by being honest about what's broken and what we're willing to build instead. If this resonates with you, if you're a worker in the field or someone who's been hurt by the system, I see you. This system wasn't built to hold you, but that doesn't mean you're unworthy of care. We deserve more than this, and if we can't fix it right now, we can at least start telling the truth about it. Thank you for listening.